lastly, I just want to close out with talking about diagnostics. So a question comes up. Well, how do I know if this is working? What do I need to look for? But before we get into that, I want to talk about just a couple misconceptions and things to watch out for around the topic of diagnostics. So first of all, there's a great pull towards pulse diagnosis and learning it, and there's a certain esoteric draw to it that a lot of people have, particularly in the West. And while it can be useful in some instances, it's not a completely reliable tool. Quite often, I've even known of stories of very loved pulse masters diagnosing the same person differently in different scenarios. And there's actually been clinical studies, blind studies done on pulse testing with experienced doctors from anywhere from 3 to 15 years with experience. And basically, there's been no inner reliability between their different assessments with pulse. So I wouldn't get too caught up. Pulse was a later addition to Ayurvedic diagnostics and the Ayurvedic canon. So perhaps there's some misconception, misunderstanding, as it is, coming from a later time. So before you go spending a lot of money on a pulse course, know that it is a fairly esoteric, intuitive practice, and you can't just learn it from a weekend or from a CD course. And the second thing I want to talk about is dosha. So first of all, there's all these little kind of dosha tests around the internet, and just like the diet lists that people put out there, they can be useful to get a kind of general idea about what Ayurveda is about what your constitution might be. But really, there's just so many details that go into figuring out someone's dosha type, or more properly, the prakriti, your kind of base state of balance, that even a lot of doctors, once again, have a difficult time assessing this. And some doctors don't even consider it in their treatments. They actually look to treat imbalances first, and they go from there and see how the patient reacts. So just know that these little tests won't tell you too much, and they won't help you implement either, because in order to have a full diagnosis and a full pathology, you really need to look at doshas, the elements in a person. You need to look at their shrotas, or their channels. You need to look at their digestive fire. You need to look at if there's toxins in the system, and there's just a lot of details that go into making up a full assessment. And then when you go to apply it, you also have to take into account, how long a disease has been present, how long the problems have been present, what's the season you're trying to implement this stuff in, what's the person's personal geographical location. So there's just a lot of details to do that, some of these little simple things that people give are just a really introduction, but I think it tends to give people an impression that Ayurveda is more simple than it really actually is, which I don't think does good for anybody, including, the depth that this science can give as a approach to medicine. Ayurvedic has an extensive battery of diagnostic tests and skills and procedures, so you can tell how it's functioning, and it gets quite complicated. And to properly gauge it, it's ideal to work with a physician once again, but there are some basic things that we can look out for in ourselves, especially with more knowledge. And one of the first things we can do, once again, as I was talking about, is just taking one or two things at a time and noticing the effect before moving on, especially in our climate and our times. And if you don't have someone you're working with, take it one thing at a time to notice the effects for yourself and learn from them. Past that, one of the most fundamental tools we have, since we've been focusing on digestion, to tell us what's going on in our body is our stools, because that's something we all have access to, and it's really easy to see and gauge. Basically, ideally, you should be having about 2 or 3 bowel movements a day. Essentially, that's one bowel movement for each large meal that you're eating. So if you're not having a bowel movement for each meal you're eating, that usually means your digestive tract is backed up somehow. And this also, once again, means the bowel movement should come by itself. It shouldn't be because you just drank a cup of coffee or tea or alcohol or any other kind of habitual thing to keep your bowel moving, which it's going to imbalance you more. So it has to be a genuine bowel movement. And when the bowels are stuck, this is going to affect the physical health, but it can also deny access to some of the higher yogic practice, because it's really vital that the waist moves downwards so that the body once again can have access to that critical navel center, that the prana is flowing properly there. That's where it's really our seat of our life energy collects there, and it's distributed to the rest of the body. So without that, you're not going to get access to prana. It can't build up in the system as effectively. You can't work with it as properly. So this has multiple repercussions as well for other things past the physical health. When you do go to your bathroom, it's really ideal. You should be checking your feces and just seeing what they look like each time. Ideally, the ideal stool in Ayurveda is a long banana-shaped stool. It should basically look like a medium brown banana floating in the water, and it shouldn't have any odor. That's the ideal. And basically, if there's any kind of deviation from this, then you know that there's something off in your digestive tract, and you still need to work and do some adjustments. So if your stool is sticking, or if it's sinking, or if it's really dark brown, or if you have lots of small pieces, there's a lot of different things that looking at that can tell us, which I'm not going to get into because this is once again an introductory. But it's just good to know that if that's happening, or rather if that's not happening, if you don't have the ideal, then something's off, and that's true for a good lot of us. So it does take some time, some work, a lot of adjustments, but it can be done. Also, you want to notice how you feel after you eat a food item is another good cue. Ideally, there shouldn't be any kind of disturbances in your mood, in your energy levels. You shouldn't be getting tired after you eat. If you're having any kind of burping or gases, you're having any kind of pain or any general sensation within the digestive tract after you eat, then you know that something's going off, something's going wrong. And once again, just a cue that something's going off, and we don't have time to get into that here. But you can look into, once again, our course site where we give some more of the background on this, some basic things to work with along these lines to think about. But you should have also, along with that, some stable level of energy throughout the day. So you should be able to wake up without, being lethargic. You should also be able to go to sleep without trouble. You should be able to sleep through the night without trouble and being woken up easily. So if any of these things are getting disturbed, then that's the sign that something off in either the diet or the lifestyle. Once again, the meanings about each of these different shifts has it can be a wide variety of things depending on the pathology for what comes up. And it's beyond, the pathology in Ayurveda is pretty in-depth. It's very complex and complicated, and oftentimes what looks like what might be a vata vitiation can actually have its source in either a pitta or kapha, and a lot of times the doshas can combine to do different things together, and there's a dynamic interplay. So it's not as simple as just making off a checklist if I have a pitta disturbance. The cause of that could be something completely different, and by doing something that you think will be treating your pitta, you're actually going to be throwing yourself way more out of balance. So you can't really self-regulate this stuff without some knowledge, and in many cases a lot of knowledge to implement it within a clinical situation treating disease. So with that said, yes, these are just some simple basic diagnostics to tell that something is off. And these are things that, Western medicine is going to pass over and say it's not a big deal. But these are things in Ayurveda that show that there is something brewing. That these are root causes. Even these subtle little disturbances are sign that something's off in the system, and that you should probably be looking a little deeper at your lifestyle and your habits. So that's going to conclude this introduction to Ayurveda with, the implications of yoga practice, which we touched on very, very lightly here. And I hope it's been useful. And once again, for those of you who want some more details on this, who want to, talk more, discuss about some of the ideas I've brought up, some of them may have challenged, what you may have learned as well. Or see elsewhere out there, please go to our website and feel free to sign up. All the programs are donation-based. You can give what you want, and I'm just trying to create a forum where people can have access to a good framework in a highly structured format to learn these disciplines that you can't get through reading random articles, and you can't really apply these things or get the depth of them properly without a little more formal education in them. So I hope you're well, and yes, please be in touch if there's questions or comments, and have a good day.